Hello, I'm here today in front of the Wrigley Mansion, which is one of the Phoenix Points of Pride located in central Phoenix. It sits atop the hill overlooking the Arizona Biltmore Resort and was completed at the same time frame in 1929. William Wrigley, who is the chewing gum magnate, built the house as a fifth home for he and his wife, and it was for their 50th wedding anniversary that it was completed. The home is 17,000 square feet. It is attractive on the outside, but unbelievably gorgeous and ornate on the inside. The unfortunate incident is that William Wrigley died about a year after the home was completed, and his wife lived for quite a little more time. Then the home fell into various other additional hands. The owners of the resort had it for a while, a bank, a trust, and then Gordy Hormel, who was heir to the Hormel meatpacking fortune, bought the home in 1992 and turned it into the Wrigley Mansion Club. And for $10 a year, people can come and have lunches here, dinners, there's all kinds of functions, social gatherings, and they've restored it to what it used to be. He has passed away and so has his wife, but it remains in the Hormel family name, and it is gorgeous. If you come out here, they have tours. You can have a beautiful view of the whole valley, unobstructed here. The topic that I wanted to discuss today is part 2 of medical marijuana Mythbusters. Now in part 1 I discussed various myths regarding marijuana, but today I want to look at 3 of them. So the first one is, does medical marijuana stay around in one's system for 30 days? You know, people think that marijuana stays in your system for 30 days and that you can fail a drug test and that it would remain psychoactive for that amount of time. And the answer is, well, part of that is true. Marijuana can stay in your system for 2 to 4 weeks after smoking marijuana, vaporizing marijuana, eating marijuana, whatever the case, however it got into the body, it can stick around. And here's how. Let's say when someone smokes medical marijuana, it goes into the bloodstream very quickly and it circulates around. And about 1% of that marijuana actually goes into the brain. So when it goes into the brain, there are receptors in the brain for it, and it has its psychoactive effects for whatever medicinal qualities necessary, such as reduction of nausea and vomiting, weight gain, pain relief, things like that. So it acts there for a few hours, and then the psychoactivity is done. But what happens to the rest of it as it goes through the bloodstream? Some of it gets excreted in urine or feces, but some of it gets sucked up into one's fat cells. It's called lipid soluble, so it gets sucked up into fat cells. Well, there's no receptors for it there, but it does hold on to it for a while. It may hold on to it for a few days or a few weeks. That's why it can stick around in your system for 30 days. It's not psychoactive in your system for 30 days. It's only psychoactive in your system for a few hours. Now, as the THC, which is the psychoactive component of marijuana, gets slowly released from those fat cells back into the bloodstream, the question is there some psychoactivity remaining? The answer is yes, but it is not nearly enough to make somebody high again, so to speak. So that myth is dispelled partly. There's not psychoactivity for 30 days, but it can remain in your system. You can fail a drug test multiple weeks after having smoked marijuana, because the drug test only tests for an inactive metabolite. A blood test could test for the active metabolite, but the urine test, that's what it tests for. So that's the first topic. The second topic is, can marijuana cause a fatal overdose? Well, that's a common misconception, and the answer is it has never done that. All of the overdose fatal cases in this country every year, and there's about 20 to 25,000 of them for unintentional fatal overdoses, no one has ever been able to point to marijuana as a primary cause of a fatal overdose. And allow me to explain. Marijuana has multiple receptors around the body. There's THC receptors in the brain. There's THC receptors in the GI tract, for instance. That's one of the reasons why it works so well for Crohn's disease and other inflammatory issues in the intestines. However, there are no THC receptors in the respiratory centers that control, your respiratory rate. So unlike narcotics and sedatives, which can decrease the respiratory rate down, 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 then somebody drinks alcohol, it can go down, down, down more, and then it can get so low that a patient dies, marijuana doesn't do that. So it has never been the cause of a fatal overdose in this country, and that's a myth. So that's discounted. That myth is busted. So the third and final segment of today's Mythbuster is the immune track, the immune competency. Does marijuana decrease a person's immune system? And the answer is no. There was some research back in the 1970s done by a researcher named Nahas, which actually did show that between marijuana smokers and non-smokers there was a decrease in immune competency, that the immune system was affected. Well, he tried to reproduce that research, and multiple other scientists tried to reproduce that research, and nobody was able to do it. Every study that had been done after that showed that there was no effect from smoking marijuana or the effects of THC on the immune system. In fact, in 1985, when Marinol, which is a synthetic THC that's FDA approved, was going through its approval process, the FDA didn't show that THC had any deleterious effect on the human immune system. So that is in fact a myth. There has been no known deleterious effect of THC on a patient's immune system. And one last point to that is that marijuana works very well for patients who have multiple sclerosis. There's more and more studies coming out on that, but the hope is that actually marijuana can help the immune system so that the myelin around the nerve is not continually decreased. Anyway, there you have it, part 2 of Medical Mythbusters. Check us out on the internet at arizonammc.com or call us today toll free at 855-294-3227. Our doctors are licensed, knowledgeable, compassionate. They can help you undergo your medical marijuana evaluation expeditiously. We get your medical records for free, scan in your documents, take your pictures for the state application, and help you do the state application in the office, all for one low fee. Thank you very much. Have a great